Americans secure health insurance through their employer?
Well, the advantage of the system as it is now, while it's highly imperfect, and I think there's a lot of room for improvement, is that when individuals are going to look for a job, they're not necessarily coming together as a group for the purpose of buying health insurance. They're coming for other reasons. That's the type of profession that they're in, and so they're coming together. Once individuals are in, particularly in large employers, in these large groups, then it's somewhat of a natural risk pooling mechanism for buying health insurance. So that in a very large firm, essentially the average cost of the individuals for healthcare purposes in that pool are going to usually be about the average that you see in the population at large. And so it makes sense from a risk pooling standpoint for those individuals to come together and purchase health insurance. The advantage also, particularly for larger groups, is that there are some administrative economies of scale of buying in a big pool like that. And so the cost of buying health insurance for them is going to be lower per unit of benefit than an individual or a smaller group.
Thank you. Mr. Eckstein, you testified that the tax credit element of the CHOICE Act is justified because large employers have significant benefits under ERISA. Can you talk about some of the advantages that larger firms currently have over small businesses when it comes to purchasing health insurance?
Well, they have a larger pool of people. It makes it a little bit more of an advantage for the insurance company to deal with that large group. Our small group, all we need is one or two catastrophic illnesses, and we become very unattractive to the insurance companies. As I stated, we've been stuck with the same insurance carrier for 4 or 5 years now because no one else wants to quote us, because we've had one spouse with cancer. One of our employees had cancer, and they just, we're stuck with them. Nobody else will quote us.
Okay. Let me go to Mr. Shabat.
Thank you. Dr. Blumenberg, I'll begin with you if I can. Could you discuss again a little bit how small businesses can, since they have a disadvantage to larger corporations, larger companies with respect to scale, et cetera, how can the little guy compete against these larger companies if they're trying to provide health care for their employees?
Truthfully, I don't believe that they can. And that's why I think that placing the emphasis on trying to get more small employers to be direct providers of health insurance, their own purchasers of health insurance coverage, is probably not going to be an effective way for significantly expanding health insurance coverage, because they will always suffer from being the smaller scale that they are and having the risk pooling issues and the administrative cost problems. They also have higher turnover than larger firms, which increases the administrative cost of the firm providing health insurance. They've got the problem of having lower wage workers than larger firms and medium-sized firms on average. And so the affordability issue is also a very prominent one. So from my perspective, the way to get more workers in small firms into health insurance coverage is through a broader-based reform mechanism that's going to address the needs of really all uninsured individuals, and those people in particular with modest income and high health care needs.
Okay, thank you. Dr. Nichols, I know that you're a big proponent of the CHOICE plan. Could you tell us again what are a couple of the major things that you think are so beneficial of the plan, and why those of us that may not be co-sponsors yet should consider co-sponsoring the legislation?
Well, first of all, it's bipartisan. And in my opinion, we need to show the country that we can work together. And I think just the fact of co-sponsorship and the leadership that's already been shown reassures the country. Frankly, those of us who live in Washington are trying to solve problems and not just posture about them. Second, it sets up a mechanism whereby people could buy health insurance that would be cheaper for them than it is today, and it targets that incentive directly at the group that is probably in most need of relief, and that is the small business sector. There's no question, and I think Mr. Eckstein's story is the most ringing in my ears. Here's a family-owned company, 2 generations, I believe you told us, that is having a hard time maintaining, offering what they want to do because of 1 or 2 people in their healthcare family getting sick. It is that kind of, I would just say, outrage that we ought to fix. And I don't blame the insurer. The insurers are in a world where they're following the rules they have that we've set up. The whole point of the Choice Act is to change the rules and to change the incentives and to change the ways we can make insurance more available to more people. So all that's good. My quibbles are that I think we could actually have our subsidy dollars go farther to cover more people if we are able to target them to low-income workers as opposed to higher-income workers who just happen to be in smaller firms. And the classic example, not at the table today, would be a law firm or a consulting firm of, a bunch of egghead economists doing very well, thank you very much. Why should you subsidize them for they don't need it, but other people do. So that's what I would say. The second thing is I would agree with Linda. In the long run, you want to think about how we're going to help more workers in general and more firms concentrate on what they do best. What they do best, as you all know, is create jobs. I want to remove the worry of health insurance from the plate of the CEO so he can focus on fixing roofs and making Coca-Cola even cheaper. I'm in favor of that. I'm a big Coke fan. So I'll just say what I want to do is remove the health insurance, if you will, nightmare from their plate by creating a marketplace where all workers can go. They can contribute to those workers' purchases if they want to. It's America, and that's part of the labor contract. But let's not build that as the only way to do it, and that's where I would